What is up, YouTube? It's your boy Zid back at it again with another video. Recently, I received a comment basically saying that this person wanted to skip being a CNA and go straight into nursing school. And I cannot even think of any good reasons as to why someone should do that. Y'all will hear me say on this channel, I've said it multiple times before, become a CNA first.
Ain't that right? He ain't lying.
Become a CNA first. Volunteer at a hospital, volunteer at a nursing home, speak to some nurses, speak to some people that work in healthcare, because you don't know how many people I've seen go ahead, get their CNA and realize I don't like the job. I don't like the job. I don't like the fact that I'm working 12-hour shifts. I maybe can do it for 3 months, but I can't do this long term. Sometimes patients can be rude. Sometimes family can be rude. What else? It's catty. Management is this. Management is that. The job is hard. The job is not supposed to be easy, which is, if it was easy, everybody would do it. This is something that I speak and I try to give advice very heavily against. If you want to become a nurse, registered nurse, LPN, BSNRN, or anything higher, try to get your foot in the door, which is why I feel like being a CNA is the best thing that you can do when you are thinking about becoming a nurse, because it literally gives you a foot in the door at a fraction of the cost that a nursing school would. I think some programs are free for you to get your CNA. Programs are free, maybe $500. Most I've seen was probably $800. I paid around $800 to get my CNA, and I used it for 3 years before I became a nurse. I was, taking my prereqs my first year, got into my program my second year, applied for 2 different schools, got in, but did my ABSN, and then I got my, my license. But I think that becoming a CNA shows you if you can do the job or not, if you enjoy the job or not. So many people become CNAs and they're like, I realize I don't want to do nursing. You know what I mean? I've been doing it for a year. I've been doing it for 2 years, and I realized I don't want to do this long term. So they end up leaving. They end up dipping. They end up going to do something else. They realize that healthcare is not something they want to do. But what you don't want to do is go to nursing school, get through nursing school, cry through nursing school, work your way through nursing school, become a nurse, and then realize I don't want to do this job. I'm not happy doing this job. The reason that I do well at my job and I enjoy my job is because I knew what I was getting myself into. I knew when I was a CNA that, good, bad, or ugly, everything that comes with healthcare, I want to be a nurse. I want to help people. I stayed in it 3 years and getting underpaid because I already had a college degree in a non-nursing major. And I still went to nursing school, finished, and got my license. And I've been nursing. I've been a male nurse ever since. Being a CNA is a tough job. It teaches you the ins and outs of everything. It shows how well you are with patients. It shows how well you work with other nurses. It shows you, kind of like a full scope of what it's like to be an employee in the hospital. You learn a lot. You see a lot. Why would you skip that learning curve? Which is why I say just go ahead and get your CNA first. You don't have to be a CNA for a long time before you become a nurse. You can be a CNA for 6 months. You can be a CNA for 1 year. You can work in a nursing home. You can work in a hospital. Just to give a little bit of more background, when I worked as a CNA, I worked on a neuro unit, stroke unit. I worked on a pulmonary unit. I worked on a cardiac progressive unit. I will float down to the ED quite frequently. The opportunities are there. I mean, you can literally change, a different specialty. I think in a hospital, they say around 6 months. Every 6 months, you can go do something different if you want. But being a CNA allowed me to see so much, learn so much, and do so much. And that's when I knew that this is something that I want to do. I've seen CNAs come, stay as a CNA, realize they didn't want to do nursing, and just remain a CNA. I've seen people come, get their CNA, realize they don't want to do it long term, and leave. They leave. It's just something to think about. But I don't like the idea of skipping a valuable step such as a CNA and then going straight into nursing. Now, don't get me wrong. There are plenty of people that I know that have done it. They enjoy it. They're great nurses. and they never once clocked in as a CNA. But then there's other ones, and I realized that the ones that stay on their feet, typically, work a little bit better with patients, are a little calmer during their shift. Um, they were CNAs first. They were CNAs first. They worked in a hospital, nursing home, home health. They saw healthcare from a very entry level position than someone who came in and just went straight into critical thinking, passing medication, assessing patients, working on the progression of someone's care as a registered nurse. I'm just saying. It's just my thoughts. It's just my thoughts. My fiance, who's a nurse, she was a CNA first. I was a CNA first. A lot of my friends who worked in healthcare outside of one were all CNAs. Um, CNAs. What another one was I think she was a physical therapy assistant. Uh, it's just so many options in healthcare, and you don't have to go straight into nursing, because if it's something that you think you want to do long term, then why not give the investment of being a CNA for at least 1 year? Rule of thumb for me in this channel is at least 1 year. But if you become a CNA, don't get stuck. Still go to nursing school if you want to. If you feel like you can do the job, tolerate the job. Still go into a specialty that you like, because it's going to help you in your longevity within being a registered nurse. And just embrace the opportunity, because if I would have went straight into nursing, I don't know what type of nurse I would be now. If I wasn't a CNA first, if I didn't see all the units that I saw, if I didn't come in it with the sense of I've seen some things, I've done some things, I've had some prior experiences, and I still want to do nursing. I feel like it hit a little different when you do become a nurse, because you've been through all the steps. Um, it's just my thoughts. It's just my thoughts. I'm not going to, tell you what to do. I'm not going to tell you what's right and what's wrong, because there is no linear 100% answer. I think that it is really subjective, and it goes from person to person. So if it was up to me, and a lot of nursing schools have implemented this, you have to be a CNA first. You have to be a CNA for 6 months, a year, before you can even apply to nursing school. Some make you get your CNA just so you can get into nursing school, because you have that base level of knowledge, and you at least know how to do some of the tasks of a CNA, how to get a blood pressure, manually and automatic, which most places you get it is you're going to be using an automatic Dynamap blood pressure, portable blood pressure monitor system that you roll into the patient's room. You're going to know how to count respirations. You're going to know what a normal heart rate is. You're going to know what a good blood pressure is. These are all things that a CNA class will teach you. Some even CNA classes allow you to draw blood. The CNA care partners at my hospital system, they allow them to draw blood. I didn't draw any blood as a CNA. I now have practiced and got my reps in, and made it like a normal thing for me. But imagine if I came into nursing with that skill already. How much easier and faster I would get some of these tasks done. But like I said, it's just something to think about. I'm not the moral police. I'm not the you got to do it this way, because that's not what I'm here for. I'm here to encourage, motivate, inspire, and just give you the real. That's what this channel was made for, to give you the real. I'm a little under the weather, but this channel was made to give you the real, and that's exactly what I'm going to give y'all. I don't think it's a good idea to skip such a valuable step, because you could get into the field, become a CNA, and realize, I hate this job. I don't want to do it. Give yourself a fair shake, man. Give yourself a fair shake. We're almost at 20K. Shout out to everybody that's been subscribing, liking, commenting. Let me know questions y'all got below. Let me know what you think, man. Am I wrong on this? What's your thoughts? I got to go to work, so I'll see y'all on the next one. That's all I got. All right? Peace.